Okay, welcome back, everybody. And I'm delighted to be here with another immigrant. And if you don't get the accents, you know, yeah, he has a bit of an Irish accent. I mean, given that I just started that way, let me ask you the first question. Just give a snapshot of your background. Where did you come to the United States to begin with?
I came to the state of Illinois. I went to school in a town called Urbana-Champaign, which most of you would not have heard of. It's 130 miles south of Chicago. I did pick it on purpose. It was not an accident because it was very similar to where I had gone to college in India. And I came there because this is, remember, 10 years pre-internet, so you came there based on reputation of a place, and it was one of the best engineering schools in the world. So where better to come learn? The thought was just to come learn. Now that was 40 years ago, and 40 years has gone by. Life happens, opportunity knocks, and you take advantage of that.
So we've been together on a number of occasions over the last couple of years at various meetings. And one of the things that I've observed when you get up to speak is you're eternalistic, you're phenomenally optimistic. It's like you exude optimism. Why?
Look, life's relative in some sense. So if I look at, I'm a fundamental believer, if we can drive economic growth, then you can actually have a lot of opportunity to do all the other things we all want to. If I look at economic growth, what are the ingredients for it? You need skill, talent, you need an environment that supports it, you do need investment opportunity, which is not always just a lot of capital. It means, is there liquidity? Do the institutions promote building businesses or not? If you take those, where in the world would you bet apart from the United States? Talent wants to come here. I guess we're examples of that.
Well, when I came, I didn't think there was talent. People didn't think it was talent. It was opportunity.
But it is, right? Because I always say you have to be able, I think a lot of people are not aware of opportunity when it comes to knocks because people are blind. I do this thing only. If you're aware of opportunity, then you can take advantage of it. So I think that the institutions and the philosophy and what the country wants to do, to me, I'm optimistic about it. In 2020, right when we were in the depths of the pandemic and GDP was down 10 or 15%, and you had people saying, oh my God, we are heading for a recession, this is going to be worse than the Big Depression, I kind of looked at the facts and I said, I don't see a recession coming, which is why I'm optimistic. I actually think that we can eke our way out to 2-3% growth. Well, surprisingly, that's where we have been for the last 4 years. I see that carrying on, and I acknowledge there's a lot of headwinds in the world. There's headwinds in the Middle East, and I wish that situation would get resolved. There's headwinds in Ukraine. I do think that the whole China trade and military issue is an issue. But despite all that, I actually remain optimistic, especially for, I'll call it North America for sure.
So let me switch just a little bit. Years ago, IBM promoted big time a technology that we all remember, Watson. Mm-hmm. And I remember being at the IBM facility down Lower Manhattan, getting presentations on Watson, and it was to make dramatic changes, et cetera, et cetera. But obviously it didn't deliver what it was expected to deliver.
Yeah.
Given that whole experience, what were the lessons learned from that whole experience?
So you're talking about Watson Health. So I'll just confine, because Watson is a bit broader than just health, but I think you're right, Michael. So Watson Health did not deliver. Let's just acknowledge it. I'll acknowledge it, right? So if I go back to what were the observations, what led us down that path, and then what were the lessons learned because it did not work. So the observation is there's a lot of data that is leveraged in medicine. AI is a great tool to take advantage of lots of data. Could we apply AI to data in medicine and then come out with incredible learnings that then could be applied? Okay, as a strategy sitting up front, I think that makes sense. Here were three completely missing things. Did we, IBM, sell and aware of how doctors and providers do their work? No. So that's strike one. Strike two, if you're going to touch how doctors do their work, you got to deal with the regulators. Not just the FDA, but also regulators in every state who want to manage this. Did we understand anything about those? No. Did we have a lot of doctors on our staff? No. So to me, this is often the difference between a strategic observation and where you go play. But to turn it around, we have actually made more progress in the last couple of years, I'll say applying AI to health. But now I'm very clear. We are computer scientists, we know AI, we know nothing about medicine. Let's start with that principle. But now can we pair up with those who know that and make a lot more advances? And why I say we didn't, if you don't understand doctors and how they do their work, you can go in with them and say, oh, I can find a better protocol for you. If it's not in their workflow, if it's not how they were trained, that's not very meaningful. So to me, those were really big dangers. And one final one, with early technologies, you should always try to come in and try to provide little pieces. If you come in with a monolithic black box and kind of say, just trust me, it does not work. I think experts, and doctors are experts, want to understand what was it built, what was it trained on, what would it do if I change this input. So you got to come in much more as a partner than with, here's an answer.
So on healthcare-related technologies that IBM is working on today, explain what those are, at least some of them, and what is the area that you're working on that you believe will have the most potential dramatic effect or positive effect on healthcare going forward? What's your next new Watson Health version?
Yeah. I'll come to that, but I'm going to actually begin with the mundane first, because I'm assuming even healthcare systems have procurement. I don't think they can live without that.
Sure.
They have accountants.
Oh, yes.
I guess they don't do any billing, or there's a little bit of billing in hospitals.
We have a lot of billing. Revenue cycle, we've got thousands of them.
And if you have hospitals, I'm going to guess you get phone calls from patients and from other people. And you have
well, yeah, we can send some of them to you, you know.
So
we get them all the time. Yeah.
So I begin with, let's take a layer where I think the risk is far lower to apply technology and artificial intelligence. Let's first take all of what I'll call, which some people will call back office functions. I prefer the word enterprise functions because they are critical. So can you take your invoicing? Can you take accounts payable? Can you take procurement? Can you take supply chain? Can you take inventory management? Can you take, how do you reconcile bills? How do you deal? Can you take all those things? I'll bet you when you add them all up, it's at least 15% of what the staff and the administrative workload is. I'll lay a bet that over 3 to 5 years, one can take 30 to 40% of that out. Now, people will roll it, oh my God, no, I'm not firing anybody. As you expand, then you can kind of live with the same base. By the way, if you turn better in your call center, here's a statistic from, and this is from a telecom company. They applied AI to how the phone was being answered, 800,000 calls a month, so reasonable volume, not as much as you guys probably, but reasonable. They had 40% higher satisfaction from the callers because what AI can do is get you an answer back really, really quick. By the way, it was only handling 60% of the calls. The 40% it couldn't, it actually passes to the human to say, I don't have confidence in being able to handle this. And it was a much faster response. I think down to 20 seconds instead of the 3 or 4 minutes. I think those are great examples. That's the bottom layer. Next layer up, I would say, can only be done in partnership with somebody like you. How do you come into how providers are doing things? Can you help a nurse with notes? Can you read more things? Can you actually give a summary out from the EMR? But I would say that that can only be done in partnership with the system. I would say you can see people making some steps there, but I would not call them massive. The third, which is what I think you began to describe as what I think of as exciting, I think it is really exciting, but I think that this is still in the future. This is not now. Can we begin to use AI to do things like, can I discover maybe a use for a drug based on reading all of the literature? In your case, you have enough patients that your records probably contain those insights that people had not thought about. Can I begin to look at finding new molecules that may be good against antibiotic-resistant bacteria? So as you begin to think of those things, I'm using those two because those are examples of work we are doing with certain systems. We are quite narrow after having learned our lessons, as I acknowledged. We do this work right now mostly with the Cleveland Clinic in the United States, but with a couple of pharmaceutical manufacturers also. I really think that looking at those kinds of problems, but together with people who are the practitioners. So we say, we'll do the AI, we'll do the data management, you tell us what we should be looking for and how we should be looking for it. Can it be effective? And I think that's an exciting partnership there. So sort of three layers. So take the mundane, which I think applies to everybody here, and I think that the regulatory risk is a lot less. Take the middle, where there is. You have to do it in a way that will pass muster with the regulator, but to me more important, the expert, which is your doctors and nurses. And then the third layer, which is on the forefront of research, it is more exciting. A lot of the excitement being talked about is in that area, but I think the first two is where money should get spent.
You just mentioned the regulators.
Mm-hmm.
Now, in the whole development of AI, which has the capability of it is expanded dramatically, and some people are saying, slow down, take it easy. We don't fully understand everything about AI. And that's combined with people arguing, including some of the people that have been the architects of a lot of the new AI. We need to regulate it. Give us your perspective on regulation, slowing down, taking it easy, etc.
Yeah, so I'm going to give you first my answer, and then I'm also going to come back to why are some of these people saying these things, because I think that it is self-serving as opposed to real. I think that number one should regulate based on risk. It's really hard to regulate technology. I mean, because technology in this case is an idea, it's digital. Once it's been written about and talked about, you can't really regulate it. You can't like put the genie back in the bottle. That's way over. All you'll have to do is you'll move it offshore because it is so promising that if one country tries to stamp it, all you're doing is moving it someplace else. But should you regulate the use case? Absolutely. So should you say that something extremely risky needs a lot more verification than something that is less risky? If you're giving somebody an answer on a phone call, okay, this might be your bill, that's not going to kill you. So even if you make an error, which by the way, just to be upfront, humans make about 15% errors on these things. The technology makes about 5%, but the 5 on the technology is unacceptable, but the 15 on the humans is desired and wanted. So there's a lot of variability there as well. But I would say, I think the EU is kind of begun. They're not always right in regulation. In this case, I think they were. They put 4 levels and they said kind of level 4, no for right now. So think of those as those which can cause death. So they're talking about, in their case, self-driving cars. They're talking about autonomous surgical systems with no human in the loop. Makes sense to me. You don't really want something catastrophic to happen. Level 1 and 2, they're on, hey, level 1, we don't care. I mean, like you want to make some website in which people go and give something, go for it. Level 2 is where you might have a service center or a call center. Level 3 is kind of what I think we were talking to as clinical and things like that. There is a lot of human oversight. People are looking. It's not going to cause life or death because there is a human verifying that that's what they want to do. I think that's a reasonable approach. I would also tell you, which most people will not, hold the developers of AI accountable. Meaning if you do really bad things, don't give blanket immunity like was done during the internet era. So I would actually say that, which many people don't like to say. Now, despite what I say, which I think sounds reasonably logical, then why are people saying, oh my God, it'll create all this? If you can create regulatory capture, meaning you can set the bar so high that nobody else can come through, do you think maybe it creates market lock-in for a few people? So maybe it serves their purpose to go around saying, oh my God, we need to create an agency bigger, more intrusive than the FDA to manage models, and only those who can jump through that hoop can be allowed to ever sell AI to anybody else. So my perspective is that's a little self-serving. I will note, some of these people also say, it is the same people, you can go verify it, I'm not going to take their names. By the way, the entire economy is going to move to what is called large language models only. All of you included, are going to make zero money. What you should be getting from the government is your fraction as a human being of the share of the large language model, and then you can sell that to serve yourself. Actually, that pretty much makes my opinion that they're self-serving reasonably accurate.
With AI moving relatively quickly, what should we be really afraid of?
I think that right now, if you don't use it for what I call the first two, you should be afraid that you'll get disadvantaged compared to those who do. Having heard you in other places, you're very focused on, can I provide the best care? Can I really work and make sure, I think you use the word customer, right, as opposed to just patient. Are they really well taken care of? But that is done if you actually have a well-run enterprise. You get to commonality where it makes sense, you have differences where it makes sense. I think AI gives you another tool in your tool bag to go do that. I think that where you should be afraid is if you take some of the things that I'll call out on the forefront of research, those should be confined to your teaching hospital part, to a research part. You don't want to put them out too early because that can create a backlash. In medicine, I think the only example I can think of where it happened, and I'm not sure it happened right, is the whole area of stem cells. I got it, it excites lots of people's emotions, but that has lots of promises, but like there's all kinds of backlash that happened because of people's understanding and misunderstandings.
So let me switch. IBM has always been known as an organization with a very, very entrepreneurial, positive culture. And as I mentioned to you previously, I took courses at the IBM Learning Center way back. It has to be more than 40 years ago. How has the culture at IBM changed, or has it? What's different today than existed 15 years ago?
Yeah. Look, I think that many large organizations fall into a trap, and I call it a trap. It's not by desire, but organizations tend to create process. They tend to make people afraid. People want to make sure that they're following all the metrics. Very quickly, their culture turns insular and begins to look upon successes based on competing with each other, not based on the outside market and based on what you call them customers, or what in our case I'll call them clients, what our clients want to have. So when you make that observation, you've got to shift the culture. So people call it entrepreneurial, I'll call it more risk-taking. Can you take more risk? Meaning, instead of spending 6 weeks trying to prepare for a client meeting, can you do it in 2 days? You get speed. By the way, your client is not expecting perfection. You can go in there and say, look, I don't think this is perfect, but can I get working with you more quickly? Can I work with clients I don't know as opposed to clients I do know? Those are all risk. As you begin to take that risk, there's a huge positive flow that comes back, because then you have to work on things that you weren't always working on. You're going to become much more innovative. You can capture it a little bit in what is called a growth mindset. Those are not my words. That's a book by a Stanford psychologist called Carol Dweck. And she talks about growth versus fixed. And I think her example is perfect. These are all high IQ students. They come in there, some have a fixed mindset. The first time they stumble in a class, oh, this is not for me, I can't do it, and they go on. Others say, hey, I know I didn't do well, but I've got to learn, let me try, let me work hard. And people with a growth mindset, I think in the end, do way better than people with a fixed mindset. That's where we are taking the culture. I will tell you, I think we have managed to get half going in the right direction, but there's another half to go.
IBM overseas versus IBM in the US. Difference? What is the environment overseas? What is different about it than here? Do you operate differently over there than you do here?
Our products are the same, whether it's Tokyo or Jakarta or Singapore or Delhi or Riyadh or Paris or London or New York. Products are very much the same. We do believe that we should adopt somewhat to the local cultures. In Japan, there is a very strong feeling that if you commit something, you will stick to it, and it's the same person that has to stick to it. So we tend to hire a lot of local Japanese because that is the culture and that's what they want. So same product strategy, same commitment to customers, but you got to accept a little bit of local norms. The biggest issue I'll point out, there is no country in the world like the United States. New York is massive, we all love New York, but there's also business in Chicago, there's also business in Dallas, there's a business in San Francisco, Seattle, Atlanta, you can go on. Take every other country other than maybe India and China. It's one city. In France, almost all business is done out of Paris. In the UK, all business is done out of London. So there, our teams tend to be in one building, and they all know each other. Their clients tend to be within 10 or 15 or 20 miles of them. Japan, which is a massive economy, it's Tokyo. So the difference becomes in how you work. So we shouldn't impose how you work standards from the US onto those countries, but we do want to say, but it is a set where all the learnings from one place get reflected in our offerings, and everybody gets the benefit.
And with regard to the AI and receptivity of the AI technology in all those other countries versus the US?
So surprisingly, probably for the people here, the country that embraces it the most and quickest with no pushback is Japan. Why? I don't think the world has understood the impact of demographics. Birth rates are below replacement in many, many parts of the world, including the US. If you take immigration out, we're sitting at in the high ones. Japan has understood that. So they view that AI can help us augment human labor. And if it can augment, it's not a replacement. Their view is, take South Korea, they're sitting at what, 1.3 or 0.9, depending on who you talk to. Italy's at 1.3. So I think that in Japan, it's the demographics which have driven their acceptance of these technologies, even though on most dimensions, they're really risk averse. But on this one, they are not. So I would point there as a great success. By the way, I would point to, even in Europe, for a lot of the lower risk cases, they're embracing it. By the way, so is this country.
Right. So let me go back to, it's tied into the culture question. Attracting employees. The perceived difference of employees today, especially the Gen X, Gen Y population, as it pertains to the culture of IBM and how to retain it, and with regard to the acceptance or non-acceptance of technology. Talk a little bit about the employee demographics and what the issues are today and where you see it over the next decade.
So our employee demographics, as I look at it, so if I take our US employees, it is shocking at how stable the demographics are. I think our average age of our employees is in the high 40s and hasn't changed in 10 years. We tend to get people, I'll say that there's people who come in and leave within 5 years. At least a third of the people are like that. We have the other third who tend to stay for 15 to 30 years. So that demographic has not really changed. The question is now, who do we attract? So we have done pretty well in being able to attract people who want to work on really hard problems. About half of what we hire are engineers. And the other half of what we hire is from all the disciplines that you can think of. I think that they want to work on problems where they can really make an impact on the world. An example on that we're working on is quantum computing. It's been a 10-year bet already. It's likely another 3 to 5 years before you see commercial advantage. How many people have I'll call it the grit, to actually go do that? So for people who want to work on those kinds of problems, we tend to be a really attractive employer. And we have a lot of growth. I point to myself as an example. I came in as an individual researcher. That's all I did for 10 years. Then I shifted to try to do software development. Then I moved to do some business. Then somebody told me, you're a software guy. Do you want to learn hardware? So we offer people those paths. You got to be willing to take the risk. I'll acknowledge that. But there. I think that a lot of what is talked about, I think, is not quite as significant as people talk about. People talk about, hey, the younger generation wants more work-life balance. No, I think they want us to acknowledge they want more flexibility. That's not the same as saying they don't want to work hard. If people get their work done, why do I care when they do it? So we got to give them flexibility. I think they do want to work in environments that are much more attractive. So we went and spent a couple of $100 million putting a great location in New York City, because that is going to bring more people in, and I absolutely believe it'll keep people for longer. So those are the retention tools. By the way, 40 years ago, those retention tools were pensions and lifetime employment. So I don't react to that these are fundamentally different. That's what people today want. They react much better to getting great coffee in the workplace than they do to some of the other longer term, because they're saying, I don't intend to be here for 30 years, and we hope they will, but that's not their intention, that's not what they're thinking. I think we should listen and be aware of that and then give them those things.
Remote work inside IBM, how much of it exists?
I'll give you my...
Because you know that a lot of CEOs saying you have to go back to the office.
Oh, I already said it.
Has it worked?
2/3. So I said in January this year, after 3 years, like, we're done with remote work. Anybody who's a manager or an executive has to be in the office 3 days a week. Oh, by the way, those of you who have chosen to live in the middle of Montana, you don't have a choice. You got to co-locate. So even for other employees, we said, you got to co-locate to places where we have enough mass. Did it work? Well, about 20% of those who were remote said, we choose to leave because we're not going to relocate and we don't want to be in 3 days a week. When I say it's worked 2/3, when I observe the compliance to it, and we do the compliance loosely, we're not looking to people to become big brother yet. I am saying yet. Then
so how long is yet going to last?
If I observe the metrics go up, if I get 80% of the people compliant, I will actually not do anything more stringent. I actually think that 10% would be my preference, but I can live with 20 who is remote. Because if somebody is a deep specialist, I always make fun of this. Hopefully my friends who are accountants will forgive me. If somebody is a deep tax accountant on intercountry pricing and they don't want to manage people, what do I gain by forcing them in? If that's all they ever want to do. I think so for certain deep specialties, I'm okay with remote work. If somebody's got a unique skill, I'm okay with remote work. 10, certainly. 20, we are probably pushing it. So if 80% get compliant, I'm good.
Did you get, how much pushback did you get when you decided and you issued the requirement that people come to work?
The debate was more internal. A lot of the people who worked for me didn't feel that they could say that and impose that upon their own teams. When we actually did it, actually there was very little real pushback.
Earlier on, there was a panel on education. Now, you recruit from certain colleges. I don't know how much of that you do, but if you do, how has education got to change in your world with regard to continuing skill development and promotion of technology that we need in the future?
Look, let's come back to a very simple fact. When I came out of college, you could have probably been in the same technical area or area for 20 or 30 years. You could have made a career on it. I think that the half-life of skills has now dropped down to 7 years. We touched on AI. Most people didn't learn AI in college unless they did it in the last 5 or 7 years. So the half-life is changing. So you've got to be able to be a continuous learner. I think that is the big change than just what you learned in college. I take it to be that for people who are out of high school or college, the ability to learn as opposed to the hard skill itself is maybe more important than all of the skills. All that said, there's a few things that I wish that schools and colleges taught better. I wish they would teach everybody more communication, meaning how do you speak to others? How do you have civil discourse? How do you have a discussion with somebody? You may not agree with them, but you should nevertheless respect their opinion. And how do you do that? How do you teach people to be able to communicate succinctly as opposed to in either not communicate at all or in a way that is like completely meandering to the audience? I think of most people as being somewhat impatient. That may be the polite word. Attention deficit would be a less polite word. If that's the case, you got to be able to convey to people in a minute or two what you'd like them to take away from a conversation.
And following up on that, the IBM Training Center that I participated in years and years and years ago, where is that in the context of the IBM culture today, and what changes are you making or not making, and how do you see the future of that as a component of the culture building for IBM?
So I'm actually going to take an idea away from you when we were talking about all employees. So right now, for everybody who's a leader at IBM, so think people who manage people and who are executives and making decisions, we insist that not just when they become one, but with every promotion, they come and spend 3 days in a class in the learning center, which is up in Armonk, New York, so about 30 miles north of here. And we want them, A, they meet other people, 2, they get a lot of information, they think, because I think what we all lack, I mean, anybody who is in a profession lacks time and time for self-reflection. So those 3 days give them time to both get some new ideas, meet and see their colleagues. Your point of international, they tend to be from all over the world, so they think and talk differently. They have different issues, and they also self-reflect along some of these principles we talked about. I mean, one that I want every person to think about is you can't be authoritarian anymore. So we believe heavily in you got to have followership. Are people willing to do what you're asking them to do? Is it voluntary? It's not authoritarian as in I'm going to fire you or I'm going to decrease your salary. I call that authoritarian if you don't want to listen. And so not everybody gets comfortable with that, but they don't really have a choice on those dimensions.
Last question. 5 years out, with regard to healthcare. Well, let me ask you differently. When you look at healthcare today, the provider side of it, the delivery of care, how do you assess it? What do you think about it? Positive, negative?
Look, overall positive. If I was to have something happen, where would I be rather than a system in the United States? And the answer is, I think the world speaks for that. So the quality of care and the depth of knowledge is unsurpassed. Now that said, I also now look at it as a business. It's incredibly inefficient. The amount of sharing that goes on means that there's a huge amount of duplication. I'm sorry, as a business person, I look at duplication as pure waste. Okay, but if all of that waste can be taken out, if that 15 to 20% administrative burden can be reduced, then that makes more care available to people. So I think those are the opportunities, and I think that those can get unlocked. You are one of the few unique entities in the US. It's not the only, but it's definitely unique, where you have the scale to be able to push on some of these things I just talked about.
This has been a pleasure. I want to thank you for what you're doing. Thank you for your friendship. Thank you for being here. And look forward to continuing to work with you and you personally and with IBM. There are things that we can be doing together.
I look forward to it.
Thank you.
Thank you.
Thank you.